Okay, everybody, we're getting ready to start again for the final panel of the day. I've already put them on notice that the bar has been raised higher with each succeeding panel. So we're looking for a grand slam here at the in the concluding panel. So it's we've continued to broaden out and build on the themes of previous panels as we've moved through the day. And now we're going to have a panel broadly focusing on investing in people and partnerships to create healthy communities. To moderate this panel and also lead it, I am pleased to introduce Cathy Baase, who's a member of the Roundtable, a member of the planning committee for this workshop, and in her spare time is the Global Director of Health Services for the Dow Chemical Corporation Company. Cathy.
Thank you, Ray. And what a great day we've had so far. I'm really excited and inspired. You know, we just to weave the thread a little bit from where we began today, recalling our title of this workshop is Applying a Health Lens To. And that health lens broadening to the private sector. And the objectives that we started with, you know, exploring what business can offer to the movement, discussing areas of potential as well as models, and then providing a platform for discussion about how to promote and support health in all business practices, policies, and investments. And that was the beginning of the bringing together of all of these different panels and how that story can begin to advance the work of the Roundtable. In thinking about it today, we've had the potential, I think, is out there, and we've seen a lot about potential and opportunity. And as we've been talking about the applying a health lens to the business sector, there's also an inverse of that, which is applying a business lens to the health sector, and how we're actually sort of going both ways. I would also suggest that we're really focused on engagement and how we're going to get the business community engaged by itself, engaged with others, and it's this selection of commitment. We've heard a lot about accountability and a commitment and measurement in the first several panels, and in some of the examples where business community is making a commitment in and of itself, in other cases where groups and organizations are soliciting that sort of commitment from them for various reasons. And I think all of those are sort of the mechanisms by which it happens. The panel that we're moving into now, the next panel, is investing in people and partnerships to create healthy communities. In this final panel, we'll focus a bit on some real world, what's happening today, sort of a state of current activities from the business community. And I'm excited to hear what they have to say, an important concluding panel for the day, and then we'll bring it back for some broader discussion. So the two speakers that we'll have here will share very interesting examples of how business is investing in community health. Their bio sketches are already included in your materials, so I will not go over those. And please hold your questions until after both speakers have concluded, and we'll have plenty of time for questions at that time. Our speakers, I will introduce briefly. John Easter is the Senior Director of Delivery and Payment Reform at GlaxoSmithKline. His primary focus is healthcare transformation and health information technology policy environment. Vera Orozonsky is the project manager of the Vitality Institute, where she leads work on employer-led workplace and community health promotion, designed for health and mental well-being. So we'll move right into the speakers.